By now, you've heard of GLP-1s, medications including Ozempic, Wegovy, Zepbound, and Mounjaro. While these medications have been around for some time, the FDA's approval as a treatment for chronic weight management has driven significant media attention and an explosion in their utilization. There are undeniable indications that the rise of GLP-1 utilization is only just beginning. Current utilization of GLP-1s to treat type 2 diabetes sits around 10 to 12% and is estimated to rise to around 35% or 15 million people by 2030. Likewise, current estimates predict that a total of 15 million Americans will be using a GLP-1 for chronic weight management by 2030. The result? A total of 30 million people using a GLP-1 by 2030. And with expanded approvals by the FDA expected for other conditions, this will drive estimates even higher. Okay, so utilization is high and rising, but what's the cost? The average cost of a GLP-1 medication is $1,000 per month per user. But the real X factor in determining the long-term cost for employer health plans is that as they are currently used, GLP-1s are most often forever medicines, without clear protocols for discontinuing use and maintaining the treatment benefits. So, high and rising utilization plus chronic and indeterminate long-term costs provides a compelling combination of reasons why employers need to pay attention to GLP-1. So, how do employers respond to the rise of GLP-1s and have an impact on what they cost their people and their health plan going forward? First, employers need to decide whether or not to cover GLP-1s for chronic weight management. This may feel like uncomfortable territory for businesses to wade into. However, the FDA will likely soon approve additional uses for GLP-1 medications. And so having clear-eyed discernment about whether to cover these medications for weight management is not just a short-term consideration, but is the first step in building long-term strategy to managing this part of an employer's health plan. Second, if employers choose to cover GLP-1s for weight loss, there are limitations that can be implemented, such as step therapy and/or requiring other less costly alternative medications to be tried before the medications will be covered fully on the health plan. A third option that is emerging is the use of third parties, such as Found Health and 9am Health, to provide the only pathway to coverage for individuals seeking the use of GLP-1 medications. When a GLP-1 is prescribed, the health plan will direct the individual to one of these third parties, who will then do a clinical assessment, manage prior authorization, and if approved, will serve as the prescribing provider of a GLP-1. In most cases, these third parties also require and provide the behavioral support and condition management support to use for continued access to GLP-1. Finally, some employers are partnering with direct primary care practices to manage their GLP-1 utilization. Direct primary care is a topic that we will be digging into more deeply in the future. However, for GLP-1 management, a direct primary care provider can provide a comprehensive solution to diabetes care and chronic weight management. GLP-1s represent a long-term cost risk, and there is a real urgency for employers to be thoughtful in implementing a clearly defined GLP-1 strategy in 2025.